And good afternoon. This is Dr. Duke Majan. At the Duke Spine Institute, it is now March 7th, 2023. This surgery we're doing now is at the L4-5 disc. It's for herniation, annular tear, left L4-5. Our patient is suffering with back pain and symptoms into the left lower extremity, which is the leg. And he is awake, of course. All right. We're going to aim for, lay still. Don't move. A lot of people ask, why do you keep the patients awake for the surgery? We don't. We keep them awake just in the beginning until we get really the needle into proper position and then test it. Shot. So you can see we're aiming for the 4-5, and I'm just going to have to take a little bit different direction, go a little bit more lateral to get around the facet joint. Shot. You can see the facet is right there in front of the needle. Shot. Show us the facet joint. There it is. That's the facet joint. So I have to get past that in order to get to the disc. You can see that's what I'm doing. There we go. I can actually feel the herniation right there at the tip of the needle. Let's verify that that is 4-5. Come south just a little bit. All right. Give me a lateral view. Perfect. Show us L5-S1. That's L5-S1 disc there. Show us the L5 vertebral body. Yes. L4. And then the 4-5 disc. There you go. Let's go with an AP view, make sure we're in good position. So if you've joined us earlier today, we've already completed 2 surgeries. The first one was a 3-level Duke laser disc repair cervical. That patient's doing fantastic. She has no more pain in her arms. That's great. The second patient, we were not able to do the entire surgery. We only got a small amount of the disc removed, and it just highlights the fact that sometimes you're not able to get surgery done because of what are called anatomical constraints, meaning the patient has an anatomy that is not conducive to surgery that you're trying to do. And unfortunately, there's no way to know that until, of course, you do everything you can do with the patient on the operating table and you make every attempt to get the surgery done. He's moving around a little bit because we're in the painful disc, right? We think this is the painful disc based on his MRI and based on where he showed me his pain was. So for those of you watching, his butt cheeks are right there. The top of the butt crack is here. And basically, when I asked him, where is your pain that you get? He told me it's in this area here. Well, when I looked here, he really has 2 discs. There's the L5-S1 disc, which is completely collapsed. There's nothing to do. It doesn't look like it's really inflamed. And then there's the L4-5 disc, which is the one we're going to fix today. He's got an annular tear. He's got a herniation. It's small. But it is on the left side, and it's touching the nerve root. All right. Are you comfortable? Are you comfy?
How you doing?
Do you know where you are? I want to make sure my patient's alert and oriented.
You know where you are, my friend? He's in the doctor's office.
In the doctor's office. Very good. I'm just poking around. All right. Are you comfortable? How long have you had your back pain? 8 years, he said, right? Lower back pain, 8 years. All right. Any pain right now? No. How bad is that on a scale of 1 to 10? The highest it went was 8? Is that what you heard? 8?
Yes.
Is that where you typically get your back pain? All right, so 8 over 10. Jordan, show us the herniation. So folks, take a look at the x-ray here. Go ahead, Luis. Can you see the white arrow, Henry?
Yes, we can.
All right, start with the middle of the disc where the die is. Show us where the tear is. Where is the posterior annular tear? Good. Posterior annular tear is there. Where's the herniation? Yes, perfect. You got it. Thank you. So that's what we're targeting, is the posterior tear and herniation. Skin knife. Now we're going to make an incision in the skin. We've already given the patient some num-num shot. Make sure the guide wire hasn't moved. Will you show us the guide wire? Now folks, what's the advantage of doing the surgery the way we're doing it? There's lots of advantages. This is called transforaminal surgery. It means it's going through the foramen. The foramen is a natural hole that's already there in the spine, so we don't have to make a new hole. We just go through an opening where the nerves come out, and we just go underneath the nerve. That's why patients have to be awake in the beginning, because I'm literally passing right next to a nerve. Think about a ship, right? When you're on a ship, it's easy to steer the ship when it's out at sea, when there's nothing around. But if you're on a big ship and you're trying to navigate a port into the port of Miami, for example, you have to avoid all kinds of things around you. You have to be very careful. So they bring the best captain in at that point to steer the ship into dock, to avoid colliding with anything it's not supposed to. Well, it's the same thing here. The most difficult part is right here, where we're going underneath the nerve. Okay? Now, this is going to be, if the patient was awake right now, he would be uncomfortable. So he's asleep. I could feel the herniation right here as I tap the tip of the dilator against the herniation. It's going to push the herniation back into the disc where I'm going to take it out. We're going to remove the herniation from inside the disc. That was a big tear, by the way. Wait, shot. That went in very easily. Man, that's a big tear. Go ahead. I can feel the tear in the back of the disc. It's called an annular tear. And in some patients it's small, in other patients it's big. In this patient it's huge. The dilator almost went in without any hammering. I mean, it almost fell into the tear. All right, so now we're inside the disc. We're at the base of the herniation where the herniation starts. And we're going to use a laser to clean this disc up and remove the herniation, but more importantly, we're going to clean up the tear as well. The tear is where the pain comes from. All right, any questions?
No current questions.
Let's show our audience, how does a herniated disc actually cause back pain and leg pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. You can see the tear right there. The laser fiber is also there. The laser fiber is 1 millimeter across from side to side. The cervical laser fiber is not the same as the lumbar. When we do a cervical and a thoracic disc herniation, we use a smaller fiber. It's 0.5 millimeter, and this one is a full millimeter. There's the herniation, by the way, and it's so big. That's part of it. Sorry, it's not the entire herniation, that's part of it. You're going to see pieces of it coming out. It's hard to get the whole herniation out in one grab. Sometimes it's just too big. Other times it's stuck down, doesn't want to come out. Ooh, could feel it moving there. May have to work on it a little bit more. By the way, is Richard around?
He's not in the office, no.
All right.
Conference room, I mean.
Remind me to talk to him. I want to send Dr. Francisini to Orlando for that meeting. All right, will you remind me?
Copy that?
When I get out, I got to talk to them about that.
No problem. Of course.
All right. Thanks. Okay, so we're whittling away. I think the herniation is still trapped there. Thank you. There's the tear, some more of the tear. Let me just show you around a little bit. On the right, let's just say 3 o'clock, that pink thing over there is the end plate, vertebral end plate. And on the left is the other end plate. And right in the middle is the annular tear. The annulus is not supposed to be torn. Tear is not normal, but tear is caused by trauma, some type of a trauma to the disc. Almost every human being alive on the face of the earth will have an annular tear in their lifetime, as long as they get over their 20s into their 30s. And many humans have more than one tear. They have 3, 4, 5, 6, 7. There is definitely a genetic predisposition to having annular tears and disc herniation.
Okay.
What is it?
So?
Everything okay?
Yeah, it's not, we are running the generator right now.
What? Why?
I think Sarah is trying to figure it out right now and call him to call, but she told me about a couple minutes ago that it turned on.
All right, well, thanks for letting us know.
Yeah, I just want,
We need to find out,
yeah,
because we cannot go forward with any other surgery
right.
as long as we're on generator power. And I mean, there's no storm out there, is there?
I don't think so. Sarah said she's in the generator power room.
No, what?
She's in the generator power room right
She shouldn't be in there.
Power, generator power?
Why is she in there?
now. I'm just telling you.
We need right way here, if anything.
Yeah, call Chaman or...
She said she's on the phone with right away.
Yeah, yeah.
Figure it out.
All right, well, do we need an electrician? Is everyone else lost power?
I'm not sure.
Okay, that would be something we need to figure out. Boy, what a day, huh? Is it a full moon? Maybe.
It's been a full moon.
All right. Well, at least this case is going well. 10 minutes max. Why? 10 minutes. If we need an electrician, we need to call. I have somebody we can call. Jamie Galt. Karen is not here. She's probably the reason why the power went out. She's on a cruise.
The battery is the laser one.
Yeah, but you're supposed to plug into.
Yeah, that's the...
There's supposed to be generator power.
Is everything... Is it right? Yeah, supposed to be. So what you're gonna do, Jordan, turn off. Check the breaker there. Yep.
This is truly trying times. Anyway, I'm removing pieces of this herniation. And this is at L4-5 on the left side. And you can see how many little pieces there are. Luis, do you need a look?
Yeah, yeah. Oscar, come this way.
Leave that, Oscar, and go help Luis.
Come this way.
All right. Well, Henry, you may experience some power problems.
If I do, I will definitely let you know.
Well, I don't see how you cannot, since we're all on the same power.
This is very true. Good point. Good point. Well, so far so good. Right now. For right now.
Luis, scrub out. All right, let's see the grabber one more time. Yeah, keep that fiber sterile. Any questions while we have the opportunity right now?
No current questions, but we do have a comment from Levita on Facebook.
La Vida Loca?
I don't know. But no, they said, thank you for showing us the remarkable surgery.
Thank you. Yeah, sorry, but you know, we do broadcast live, and the reason why is we want everyone to see what's really happening. You know, surgeries never are perfect. We try. We try to make surgery as perfect as we can. We plan, we do everything we possibly can to prepare. But the truth is things happen sometimes and you can't prevent them. Like we've lost power in the building somehow. Right now we're on generator power. Nobody expected that because there's no storm outside. So it is a bit unusual, but that said, we're doing the best we can. Still pulling out pieces of herniation. You can see another one there. That's a good one. In the end, it's the way I see it, it's all part of God's plan. And we just have to go with it. Make the best of what we can. So.
Oh, we do have a question.
Sure.
This comes from Fred on YouTube.
Hi, Fred.
And they said, hello, Doc. Please elaborate on waiting to relieve spinal stenosis even when the symptoms are minimal and or non-existent.
Waiting. Okay, I didn't understand the question.
Yeah.
Something either waiting or wanting.
Yeah, please elaborate on wanting to relieve spinal stenosis.
Wanting. Okay.
Yeah.
All right, so I'll be happy to do that since we have a few minutes here. What was it, guys? Luis? One of the breakers? It blew? All right, so let me talk about that. The question is asking, I'm just going to pause for a moment because we're waiting for the laser to come back online. Scope off. So the question was, Dr. Duke, somebody has spinal stenosis. Why would you do surgery or treat it if the patient has no symptoms? And there is an answer to that, believe it or not. Symptoms are very important, but symptoms are what the patient experiences. There are situations in medicine where the patient would have no symptoms, but there's still a serious problem. No, what are you doing? Pick it up properly. For example, let's say you had cancer, but you have no symptoms. Are you going to treat the cancer?
Aim over here and let's test it over here before you.
Well, you can't do that.
Ready?
You do that?
Yeah, hit it one time. Hit it one time.
I did.
Okay, that's it.
So, why treat spinal stenosis if the symptoms are minimum? The answer is if there's nerve damage occurring and the surgeon picks up on that nerve damage on your exam, physical exam, or nerve test. So you can have minimal symptoms, but the nerve test or the exam shows nerve damage. Then you're going to want to get that fixed. You're going to want to treat it because the nerve damage is being caused by the spinal stenosis. So just to clarify that point. Spinal stenosis, for those of you who don't know, and this is important because I get this question a lot, spinal stenosis never causes back pain, never causes neck pain. Spinal stenosis means narrowing of the spine. The only thing spinal stenosis can do is pinch nerves or the spinal cord. And if it's pinching a nerve root, you're going to get weakness, numbness, or tingling in your arm or leg. Weakness, numbness, or tingling in your arm or leg. If it pinches the spinal cord, you can have paralysis of your body. So spinal stenosis never causes pain, ever. What it causes is weakness, numbness, tingling. And then if it's your spinal cord being pinched, it can cause loss of control of your bowel and bladder. So you'll pee on yourself, poo on yourself. Or balance problems. Wow. That is a big tear. So I don't know if that answers the question that you were asking, but I think it does. Just because you have spinal stenosis and no symptoms doesn't mean you don't need treatment. Most people do if the spinal stenosis is bad enough to cause nerve damage, which the doctors are the ones who can figure that out. Okay? 5 minutes or less. Dr. B, can you hear me? Any other questions?
No current questions.
Let's show the audience how does the Duke laser disc repair in the lower back, how does it actually work?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
Welcome back. We are just finishing right now, and things are looking good. This was a left L4-5 DLDR, and we got everything out that we needed to. I'm pleased. Took a lot of herniation out. We're pretty much done. All right.
Okay, so we're back on facility power right now. I think power filter happened in the area, and is there a way that the generator works? It says that's on generator power for 10 minutes, so it's back on facility power.
There must have been a brownout. Well, that explains it. The brownout triggered the generator. Once the generator starts, it has to go for 10 minutes. That's why. It's mandatory, required. We're good. All right. Any other questions? Are you back, Henry?
Yes, no, we're back. We do have a question. This comes from Fred once more on YouTube. And they said, when doc says wait till you feel numbness or weakness before we do surgery,
I didn't say that.
I didn't know if that was you saying that or he or
No,
another
it's not
doctor.
me.
Yeah,
I would never say that.
yeah. But the question was, is that open to the possibility of having permanent nerve damage?
Yes, it is. Yes, so Fred, you're talking about a very old way of treating spine problems. Doctors a long time ago were teaching and taught, hey, don't do surgery on the spine unless the patient's going paralyzed. Well, that was with old technology where surgery was very dangerous and 25% of people died from spine surgery. You don't want to do spine surgery in that situation where the surgery itself is dangerous unless the patient is really in a critical situation and then you're forced to do it, okay? But nowadays we do spine surgery much safer, much easier, without the complications. You should not wait till you're going paralyzed. That was old teaching, and there's still a lot of doctors that say that because they were brought up in the old-fashioned way. But I do not agree with that. I do not share the belief that patients should wait till they're starting to go paralyzed before they have spine surgery. It is wrong. What are you looking for?
Just making sure that it's not stuck.
Okay, you need to get your back fixed before you're going paralyzed. With the Duke laser disc repair, 16 years, 1,600 surgeries, we've had not a single surgical complication. Now, we have had a couple of cases we had to abort where we couldn't do the surgery, not because of any other reason other than the patient had some kind of weird anatomy that prevented me from getting there, and it's very rare. I would say we've aborted maybe 0.5%, so not even 1%, but 0.5% of the surgeries. There's a chance that we'd have to abort. But aside from aborting, there is no serious risk to the surgery, so you shouldn't wait till you're going paralyzed. Blood loss, I'm going to call it 1 mil. All right, type your questions up. I'll be happy to answer them for you in a few minutes. And remember, we offer a free MRI review for those people who have a back or neck pain and you want me to take a look at your MRI. Great job, everyone. Go ahead and run us one of our patients who have had the treatment that people can see. And good morning, I'm Dr. Duke Majan. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Duke Spine Institute and learned about the Duke laser disc repair, endoscopic surgery, and you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be.
And good morning, I'm Dr. Duke Majan. I'm here with one of my lovely patients from Canada who's visited us because her back has been hurting for 7 years. She's had a herniated disc that she's been kind of monitoring at L5-S1. And finally, it really started bothering her a lot over the last 7 months to a year, causing pain down into her right leg. So she decided to do something about it, and she went to see her doctor in Canada, who then said, yeah, I'll have you see the specialist in 3.5 years. Well, that wasn't going to work for you, right?
No.
Yeah, because you don't want to live in pain for 3.5 more years. And even then, you don't know what you're going to be offered. But she found the Duke Spine Institute and learned about the Duke laser disc repair endoscopic surgery. And you had it done yesterday.
Yes, yeah.
How are you doing?
I'm feeling great today. I have no pain in my back. I have some tight muscles from me having to walk very oddly for quite a while due to the sciatic pain. I must say, this is the happiest I've been in a very long time to be able to stand up straight and go for a walk. Because I'm an active person as is. I ride horses for a living, so having to be locked up in my room for the past while has not been good. So this has felt amazing, amazing.
So you're happy with the results?
Very. I feel very hopeful also to be able to do what I want to for the rest of my life.
Yeah, after we let the disc heal, right?
Yes, full year of nothing, and then we can.
Yeah, I wouldn't say nothing, but you know, horseback riding, it's one of those things where I love horses and I love riding horses. I'm not very good at it, but I'm one of those people you see bouncing up and down, up in the saddle. So I know that it can be rough on your back, and I just want to make sure you give your back a full year to heal. So you can see in your surgery right here, we actually tested your L5-S1 disc with a discogram, which is a test done to verify that that disc is indeed causing your back pain. And when we tested it, you said, and we asked you how bad it was. You said 10 out of 10 pain. And I said, is that your typical pain you get every day? And you said, yes, it is. So we verified the source of your pain was the L5-S1, and you can see the laser was used to clean the tear endoscopically. Your incision was only 1/4 inch, and there's no need for fusion or metal or artificial discs. This surgery replaces fusion and artificial discs. What are you going to do now that you're feeling better?
Well, it's, again, don't worry, I will take it easy, I promise. But no, I'm going to be, after this, this year, I hope to be the strongest I've ever been, and I have very high hopes and whatnot. My dream is to make actually the Canadian Olympic team for my sport, and that's end goal, and I feel like it's a possibility now.
Absolutely.
To do it.
You can.
Yeah.
We're rooting for you.
Mm-hmm.
And I know you have an incredibly supportive husband who's been by your side the whole time. He's a delightful young man, and I've had time to talk to him as well. So you're lucky you have support from your family to help you get through this.
Yeah.
Anything you want to say to your fans out there?
Oh, geez, I don't even know where to start other than just this place really can offer you really what either you deserve or what you need going forward to be able to live a happy and good life. And it's amazing to me that literally it was yesterday I woke up from it and I went for a short walk like immediately, and I felt amazing. So it's very hopeful, and if you are suffering from any of it, don't wait, especially for the Canadian system. Come and do this. It's worth it. It's really worth it.
Awesome. And I'm going to be, and my whole team is going to be watching the equestrian sports in the Olympics, looking to see for you to be there.
Yes.
All right.
Awesome.
And
Amazing.
of course, supporting you.
Thank you. Yeah.
All right.
Thank you so much.
Congratulations.
Thank you.
All right. Take care. And I'm Dr. R. Dugmajan here at the Duke Spine Institute. I'm smiling because I'm sitting with my first surgical patient of 2023. I don't know if you realize that, but you were the first one of this year, of the new year. Now, you had the Duke laser disc repair done on your lower back because you had 3 bad discs, and we did that yesterday.
Yesterday, yes.
And here you are, one day later. How do you feel?
And I feel good. I feel good, and the pain that I've been suffering for months is gone. I mean, I was a little bit sore, but that's from the surgery itself.
Yeah.
But otherwise, I feel good. Feel good.
Now, you've had back pain too, on and off for 30 years. We were talking about that. Tell us about those episodes of back pain. What do they do to you?
The first one that I recall was pulling out a sofa bed thing. And I got so far with it, you know, we had company and I was opening up the bed, and all of a sudden I just could not move. I couldn't move. My husband had to practically carry me. So I was out of work for a week or so, and then at the chiropractor, and then gradually it got better, and I thought, well, that's fine. And I moved on, and then, you know, had a couple other times like that. One time I was drying my hair, getting ready for work, with the blow dryer going like this with my hair, and all of a sudden, it's like I couldn't move. I couldn't move my arm down. I couldn't, I mean, it was that quick.
Yeah.
And just, I was out again for another week, laying in the bed and doing all that stuff. And then I thought I was fine, but I always, not always, but for many years now, probably at least those 30, I had lower back pain, where in the morning I couldn't bend over to brush my teeth. You know, that would really hurt.
Yes.
So I had that.
Do you have that pain now?
No, I don't think so.
It's gone.
The pain this morning, I was the first time in a long time I've gotten up first thing in the morning and was able to walk and not have that awful pain, because first thing in the mornings was the toughest.
I'm so happy for you. So how is this surgery going to
I'm
help
happy.
you in your life?
Well, hopefully I can, once I can at least walk again. I was not able to barely walk with a walker. I was very active in my church, in my
So you
community.
want to get active again?
And being in such pain now since July, and this is the new year, I'm anxious to get back to, you know, my life.
Yes, of course. Well, you had 3 herniated discs in your lower back, and you can see in the footage where we went into each of those 3 discs, and I used a laser to clean the tear, where you had a tear in the back of each of those discs called an annular tear, and the jelly from the center was stuck in the tear, holding it open, allowing more herniations to come out. So I got rid of the jelly that was in there using the laser, cleaned out the tear, and now your body will be able to heal that for the first time in 30 years. So I don't expect you to ever have that pain ever again.
Thank you.
You're welcome.
I am so thankful.
Well, you had faith,
I
and
am.
you found us.
Yes, I
and
did.
You did what's right for your body, and I'm excited for you. So
I believe I did. I just kind of was led to you, and it just all went bing, bang, boom, and I didn't ask a whole lot of other people what they thought. I just did what I thought was I needed to do
good.
for me.
Is there anything you want to say to your fans out there?
I would recommend that if you do something to your back, that you take care of it early on. You take care of it right away. The longer you wait, the harder it is and the longer it takes.
It takes a toll on your life.
Oh, definitely. It has taken a toll on mine since this summer, for sure, where I have not been able to sometimes not function at all, barely be able to sit in a chair and be comfortable without squirming, because I couldn't find that exact place where I didn't have pain. You know?
I don't see you squirming anymore.
No, I'm not squirming. I know. That's great. Sit here without pain.
Congratulations.
Thanks to you.
All right, have a blessed day.
Thank you. You do as well.
Good morning, I'm Dr. Duke Majan. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Duke laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent. Yeah. Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland, and that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yep.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Duke laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Duke. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.
All right, I'm here with one of my patients who traveled from Australia to Florida to the Duke Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is
and
gone.
my leg pain is gone from
Awesome.
the disc. Yeah.
From the surgery yesterday.
Surgery yesterday. Yeah.
And you had the Duke laser disc repair.
I had the Duke laser disc repair. Yeah, that's right. Yeah.
So why did you come all the way to Florida from Australia for the Duke laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. The pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Duke. I found Dr. Duke, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not really, about you. It's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Duke Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system people like, the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing, and your staff is really cool. I
Thank
should
you.
say, yeah, they're welcoming, they're good.
Thank you very much.
And you are the best, I should
I
say.
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
Yeah. If you're suffering from back pain, this is like a very good cutting edge technology and very advanced surgery, which Dr. Duke has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Duke here.
Congratulations once
Thank you,
again.
doctor.
Dr. Duke Machen here, and I was again just with you in the operating room a few minutes ago. We have completed a 1-level L4-5 Duke laser disc repair for a herniated disc in a gentleman who has had back pain for 8 years, and the pain goes into his left side, down his left leg. So we determined, based on his physical exam, where he showed me the pain was, and by the way, the physical exam is the most important tool doctors have to determine the source of back pain. Of course you need diagnostic imaging because you really don't know what's going on down there, but in terms of localizing the pain, you need the physical exam. And this patient showed me L4-5 was the source of his back pain. I looked at the MRI, and sure enough, the L4-5 disc had an annular tear and a herniation. So I went in there endoscopically and we did the Duke laser disc repair procedure successfully. Everything went really well. Patient is now coming out of anesthesia. He'll be going home in about an hour. So pretty typical surgery, nothing out of the ordinary. We did have the power go down while we're in the operating room. So actually this was a good case to see what happens when the electricity shuts off. And the protocol basically when the electricity for the building shuts off is we have a generator. It keeps everything running, not everything, but everything on a red circuit. And what the red circuit is if you find around the building, you'll see a little plug or outlet that's red. That means it's connected to the generator. What that means is that when the power goes out, everything on that red circuit stays on because the generator comes on and keeps everything going. So of course the ventilator needs to be on that red circuit. The equipment in the operating room needs to be on the red circuit. But things that don't need to be on the red circuit or generator circuit always shut off, like lights in the other areas of the building. Even the air conditioning will shut down. So you have some time to wrap things up and get out of here with the patient. But fortunately, it was just a brownout. The power came back on a few seconds later, and we're back under full operation. All right, we'll take questions.
No current questions, but we do have a comment from Fred from when you answered his question before. He says, "Understood. Anxiously waiting to talk to you on Friday."
Oh, Fred, wonderful. I look forward to meeting you and talking to you as well. Yeah, Fred, you live audience?
Yeah.
What do you mean?
Well, there's a question from the live audience.
Oh, we have a question from, I see.
Oh, from a live audience.
Okay, we have one more question from the live audience. But Fred, I look forward to meeting with you and reviewing your MRI, seeing what's wrong and what we can do to help you. All right, question from the live audience?
We have a question from Bill Schmidty-Workus. He asks, how does your power going out affect LeBron's legacy?
Oh my God.
All right, so the question is from Schmoody Marcus, and Schmoody Marcus is asking us, with the power going out, how does that affect LeBron's legacy? I would have to say it doesn't. All right, hope you enjoyed the broadcast, and we'll be back in about 30 minutes for a 6-level Duke laser disc repair. And this next patient has bilateral herniations and pinched nerves, and he is actually heading to Brazil this weekend. So he wanted to get his surgery done and then hop on a plane in a couple of days and head to Brazil. So yeah, we'll be doing his surgery shortly. All right, hope you